Hey, my angels, how are you? How are you? I hope y'all are having a great day. You guys, I came across this article this morning. You know how you have like news updates on your phone or whatever, and for your area, and I just wanted to I want to let you guys listen, and then I'm going to read the rest of it, and I'm just going to give you my thoughts. So, just 1 second. Let me see.
A COVID-19 hotspot, just a short drive from Toledo. What local hospitals are saying about a possible wave of patients heading here? Continuing impact on education. Governor DeWine's new directive today. And gas prices plunging to where they haven't been in almost 2 decades. And it's not all because of COVID-19.
From 13 ABC Action News, this is a breaking news alert.
I'm aware of what's going on to some extent in Detroit. I had the opportunity to talk this morning to the mayor of Toledo, who did express concern about that.
And we start tonight with the numbers in Michigan and Ohio, and it's a drastically different story in the two states. In Michigan, 6,498 cases, 184 deaths. In Ohio, 1,933 cases and 39 fatalities. And as we first reported last week, Detroit area health systems are overwhelmed with COVID-19 patients, leaving some in this area to question, could this lead to patients heading south to seek care at Northwest Ohio hospitals? And with that, we say welcome into Action News at 11. Thanks for joining us, everyone. I'm Lee Conklin. Today, we reached out to local hospitals and health leaders to find out if Toledo's ready, prepared to handle a potential influx, even an overflow of Michigan patients. 13 ABC's Michaela Marshall looking into this. She's live with the story and the new details tonight. Michaela.
Lee, the latest numbers show in the city of Detroit there are 1,801 confirmed COVID-19 cases and 52 deaths. In contrast, here in Lucas County, officials report there are 94 total cases and 3 deaths. And of course, Detroit is roughly only an hour away. Ohio Governor Mike DeWine says he's aware to some extent about what's happening in Detroit. On Monday, DeWine spoke with Toledo Mayor Wade Kapsakavage about concerns over the Glass City's proximity to the Motor City.
The way we left that conversation was we need to get more specifics about what is going on there, because frankly, we're going to need some of their hospitals too, and so there's a flow the other way as well.
Toledo-Lucas County Health Commissioner Eric Skoczynski says he contacted the Ohio Department of Health about this too. Michigan Governor Gretchen Whitmer appearing on ABC's The View Monday.
We see COVID-19 growing at such a fast rate exponentially in our state. We have hospitals that are already at capacity.
State health leaders say several of those full hospitals are specifically in southeast Michigan. Governor Whitmer announcing the TCF Center in Detroit will become an alternative care facility with approximately 900 hospital beds. Ohio Health Director Dr. Amy Acton says her department has been communicating with health departments in neighboring states amid this crisis.
Our healthcare systems don't stop at the border. As I said before, people live on one side, work on the other. You might go to a hospital across that.
Action News reached out to ProMedica asking about concerns that our local hospitals may soon become overwhelmed with Michigan patients. We received a statement that reads in part, since the Detroit area has experienced a significant surge of COVID-19 patients sooner than our region, and its hospitals are at or near capacity, ProMedica has started taking some COVID-19 patients from that area. 13 ABC also contacted Mercy Health. We're told they, quote, can't specifically speak to where our patients come from, but a section of the statement says, we have a COVID-19 task force that is working around the clock to enable an agile response to this pandemic. The full statements from both ProMedica and Mercy Health are posted on 13abc.com. A Toledo City spokesperson told me that tomorrow morning at 11:30, the mayor has another call with Governor DeWine. Reporting live, Michaela Marshall, 13ABC Action News.
All right, Michaela.
Okay, you guys. So basically, you guys know I am in Toledo, Ohio, which is not far from Detroit, Michigan at all. As you heard, here in my city in Toledo, we have 94 reported cases versus Detroit, Michigan has over 1,000. I think it was like 1,600. And so because they are so close to us, what's happening is there aren't enough hospitals there to take on patients. And as you know, once you are diagnosed, you are having to be held in isolation for a certain period of time until you test negative. And so the concern is that, we have Detroiters, coming down here and, basically, being cared for here in our hospitals. That is not a concern of mine. What is a concern of mine are the people that are coming down who have not been tested, they're coming down to prevent from them catching it. And in turn, because it is growing so rapidly there, some of us that are here in Toledo that live here, and we are scared that they're going to bring it here, because there's a reason why it is spreading so fast there. Detroit is a bigger city than Toledo, but I mean, the amount of cases is way more than double. So there's a reason why it is spreading so quickly there. And for, their residents to flee to another state, and even, another state, another area, to try to avoid catching it, and possibly bringing the disease and making it so that it's spreaded here. It could possibly, be bad for us here. So anyway, so that is, I just feel like I can understand if there are diagnosed cases and the hospitals don't have room for them. So in that case, those people are transferred here to our hospital so that they can get the care that they need. But for the people who have not yet been diagnosed and they decide to come down just to avoid being, being sick, and they end up, having it and spreading it here, that's the concern that I have. I'm going to go ahead and read the article. Well, let me see. I'm just reading through just to see if there's anything new that wasn't said. Okay, no. So basically the article just says what you guys heard. So yeah, so that is my concern. Nothing against Detroit, because I have been there plenty of times. Great city. I would love for it to get back to old Detroit, and it's so sad because they have, Detroit is a city that really has the potential to be what it once was. It's a great city. It's a huge city. Sad to see what it is right now, but I think that, lately they had been doing well, and they had been getting back to building themselves back up. And I think this COVID-19 really has halted that. And it's kind of sad, because it's like, if it's not one thing, it's another. And, I just feel like, they're getting a tough break, but, I just can't agree with, the possible risk of, infecting people that are not in your area. But like I told you guys, like I told you guys, here in my city, when you're out and about, there are not people that are out that are, people are out. They're out just like regular. They're not really staying in. And even when they are out, they are not protecting themselves as they should. And so, for that reason alone, if we have people that are infected that come down here trying to avoid it, that's going to be the very reason why, why they get sick, including myself, because I do need to protect myself better when I'm out. But anyway, you guys, so that was it. Just a little quick video. I just wanted to give my thoughts on that really quick. And, I don't know. I don't know what's going on in Detroit, why it's spreading so quickly, but if it has anything to do with how the people, how the people here are being out and about, not protecting themselves, all I'm going to say is it's not a game. It's nothing funny about it. This thing is killing people, okay? People are fighting for their lives, okay? And it shouldn't have to affect you directly. You shouldn't have to be laid up in a hospital bed before you realize how serious it is. You shouldn't have a family member that dies because you know how to make you see how serious it is. It shouldn't be your child that's laying up in a hospital without you for you to know how serious it is. So if anybody that is in the Detroit area, listens to this, all I'm gonna, and in my area, in all areas, because what we've seen just through YouTube is that people in all areas are really, not taking it too seriously, and this is why it's spreading. This is why it's taking lives continuously. This is why cities are shutting down and becoming tougher on the people in their city and taking more control over your right to go and come as you please, because you're not thinking things through. You're not considering anyone outside of yourself, and you're not making decisions as a responsible adult. So if you can't make the decision as a responsible adult, then there may just have to be people that has to make that decision for you. So that's all I have to say about that. I love y'all. I will see y'all later. Have an amazing day.